So basically there are three types of penile. One is the malleable implant and the next one is the inflatable implant, which comes in 2-piece, and the third one comes as 3-piece. So the malleable implant is of two types, which means the cheaper range, which is the Indian implant that we call as Shaw's implant. This surgery can be done, as I told you before, for 90,000 only. But the malleable or imported implant, which can be done at a cost of around 2.5 to 3 lakhs, depending upon the implant which we choose. The next comes the inflatable implant with 2-piece. That means it has a inflatable tube and it has a pump. It does not have a reservoir. This implant we can easily do it for around 5.5 to 6 lakhs. So which means it's also very cheap. It's also a cheaper version of the best implant available in the world. The best implant which is available in the world is the 3-piece implant, which consists of an inflatable tube, a reservoir which is kept near your bladder, and a pump which is kept near your scrotum. So this implant, it costs little higher. The cost of this implant comes a little higher, and usually we do this implant for a cost of around 11.5 to 12 lakhs. So these are the types of implant which is available in the world right now. So in case of the lower implants, your penis will be always in the erect state. But in case of the inflatable implants, your penis can be erect. If you press the pump, your penis can become erect, and whenever you don't want the erection, you can reduce your penis to the normal size, which is your flaccid state. This can be done mechanically by pressing a pump which is placed in your scrotum. So this is the main difference between the inflatable and the malleable implants. But based on your sexual activity, you usually won't find any differences in the implants which you place. It is only for the concealment, so which we use the malleable or the inflatable implants.
And doctor, is there any kind of a lifetime to this implants? Like if you are going for the higher implants, there could be a longer lifetime can expect.
Usually the higher implants have a complex mechanism, because once it's a mechanical mechanism which happens inside your penis. So once you process it, the fluid has to come from the reservoir and it has to fill the tube which is placed in your penis. So this is a complex mechanism, and if there any mechanical failure occurs, obviously you have to replace the implant, or at least you have to replace the reservoir. In case of the inflatable implants, it is a rod which is kept inside your penis, and there is no mechanism which happens for your erection or your flaccid state. So basically all these implants usually last for around 10 to 15 years, but the malleable implants, like good malleable implants, are better which usually last for around 20 to 25 years.